Thank you, Acting President. I'm pleased to rise to briefly speak about the Safe Patient Care, Nurse to Patient and Midwife to Patient Ratios Amendment Bill 2019. So yes, it's been one that has been sitting on our pink for quite some time. And certainly I was fortunate to be here, I think in 2015, when we first started this notion of ratios. And while the idea began in 2000, it seems that certainly we've seen ratios being taken very seriously over the last 4 to 5 years. And this new tranche will provide that extra support we need in those postnatal wards, birthing suites, residential aged care, and also reclassifying the Warrnambool base hospital, which will provide extra support down there. And I certainly recall, and I think Mr O'Donoghue will recall, that when we were down that way during end-of-life choices, the end-of-life choices inquiry, there was noted the real need for extra support down that way to deal with the not only a growing population but an ageing population down there, and the sort of some of the remoteness of those communities down there. So that's really pleasing. Now, I remember when I last spoke about this bill, and I spoke about nurse-patient ratios, which must have been earlier this year. In COVID time, it seems like a long time ago, but I don't think it was such a long time ago. But it was a time when I wanted to use the heart emoji and use it into Hansard, and I understood that Hansard was saying no to emojis. Now, I've just checked, the Oxford Dictionary is now accepting emojis, so I'm wondering if Hansard can accept the heart emoji. Oxford Dictionary, in fact, their 2015 word of the year was "face with tears of joy." So I'm hoping one day we may see heart emojis in Hansard, and that's for our nurses. I certainly think that since I first mentioned that, our appreciation for nurses has skyrocketed. We used to sometimes call them the front line, but in fact, conversely, we now think of them as the last line of defence. If our masks are our first line of defence, if washing our hands are our first line of defence, then our nurses become our last. Nurses, we've seen how critical nurses are in our society, and it kind of pains me, in fact, just to hear myself using those military terms for nurses, because I don't think that's appropriate, and I don't think that, kind of using the sort of military language and strategies is what's going to work for us. We actually, in looking at COVID, we need to take this as a health approach, and we need to possibly stop trying to think of this as some sort of arms war or some sort of race in that way. But as we know, as we've seen, these changes are really just going to give nurses the basic needs, so that they have enough staff so they can catch a quick break between, they can have time to re-energise between shifts, that they can reduce, so we can look at reducing that nurse burnout. And I know during this year I've spoken to the union and the union head, Lisa Fitzpatrick, and that has been her concern, the well-being of her nurses. And because they put themselves before they put us before them almost all the time. So they let themselves get incredibly run down to ensure that we stay safe. And I think in looking at that, I'd also take this opportunity to call to Mr O'Donoghue for some federal assistance, and maybe he can speak to his federal colleagues around providing paid pandemic leave for our nurses and healthcare workers. I know it's a federal matter, so I would urge that if we can get our friends from the opposition to speak to their mates in federal government to support pandemic leave for nurses and other healthcare workers. I think that would be of great assistance, because COVID has shown us the fault lines in our healthcare system and the problems that have been raised here many times, and certainly Ms Maxwell raised a number of those concerns in her contribution, and I do concur. You know, we've seen our nurses stretched too thin. We've seen that just their sick leave being inadequate. Nurses don't want to go to work sick, but in many cases they do, because there's just not enough people to cover those shifts, and their sick leave has run out. So this bill has the support from, it would appear, everyone in this chamber, which is a lovely change and probably a lovely way to finish this week. But when we think about this, I wonder if we had listened to nurses sooner, if we had really taken this on sooner, whether we would have been in a better place. You know, when in my electorate, when the housing towers in Flemington and Kensington were closed down, many people contacted my office and said, why did we send in 500 police? Why didn't we send in 500 nurses? Because that would have been the health response that was needed there. It would have been a much better response, I think, but simply we couldn't. We don't have that sort of surge capacity in our healthcare system, and we should. So I'm also very happy to see the government providing more midwives. I certainly have one of the busiest birthing hospitals in the state in my electorate, Northern Hospital in Epping, which is, I think, getting about 70 new babies every week. There's also 70 new houses being built out in Hume every week. So this will really help them up there. The extra midwives will be incredible for the mums and nurses in the postnatal wards up there. At the moment, we've got one midwife to 4 mums and 4 babies. And if there's no twins, on an evening shift, a midwife will be responsible for 6 to 8 mums currently. So this legislation will actually really lighten the load for all midwives, but particularly I'd like to do a shout out to the midwives at the Northern Hospital. We see that those midwives are just, given those numbers, are constantly on the run to give every mum and baby the medical attention they require. And sometimes it's just, as I've been hearing, it's just not possible, and they're just trying to do their best. And this is the strain and the stress that this puts on nurses who are just feeling that they want to do everything they possibly can, and it just physically isn't possible. And in fact, one nurse was telling me that in one case she rushed to assist in an emergency in another room and left her patients for 3 or 4 minutes. And in that time, one of the babies she was responsible for had its heart rate drop really dangerously. So then she had to hit the emergency button in the next room, and she was running from emergency to emergency, and it was, there was that chaos and just the strain and stress that put on that. Well, she was that woman that was just something that we really need to avoid, and we can avoid, and this bill will assist us in doing this. More nurses and midwives will benefit our society. It doesn't just benefit us, but it will hopefully benefit the nurses, so that they can work better, that they can work without the stress and strains that they're experiencing today. So I'm very happy to support this legislation. I know it will improve safety, and I continue to emoji heart our nurses.
Thank you, Ms Patten.